So it's now my absolute pleasure to introduce your moderator for today's discussion, Dr. Deepy Sur. Dr. Sur is CEO of the Ontario Association of Social Workers. She holds extensive clinical social work expertise in mental health and has led health system planning and strategy in senior leadership roles for over a decade within the healthcare system. She also has a special research interest in interprofessional and empathy-centered care. And Dr. Sur is chair of OASW's Equity Integration Advisory Group. Deepy, I'm so thrilled to welcome you to this important discussion today, and I'm pleased to turn the virtual podium over to you.
Thank you, Vanessa, and thank you, virtual members and attendees. We are so excited to see that we had a large registration re-register with us today, and it's my pleasure to kick us off. I firstly have the pleasure of introducing a wonderful panel who swiftly made time to reschedule after last week's rainstorm. And so today we hope to have an exciting discussion together. Firstly, Anamika Bajnath is the project manager of equity, training, and partnerships within the Center for Excellence Teaching and Learning at Toronto Metropolitan University. In this role, she leads special projects with an equity, community, and inclusion lens. Anamika draws on decades of varied experiences, including as a child's rights advocate, a previous senior policy advisor at Team OASW, 15 years as a faculty advisor with York University, supporting emerging social workers to integrate equity and anti-oppression into theory and practice. I am so pleased to see you, Anamika. Thank you and welcome. I'll now move on to introduce the rest of our panel. We'll get started. I'm welcoming Candice Kochapa is a tenacious advocate for intentional change making, where people are the catalyst for sustainable equity and inclusion, and she lives, eats, and breathes this daily. Identified as one of the top 25 women of influence by Women of Influence Global, and top 75 Canadian immigrants, and top 100 accomplished Black Canadian women, Candice has spoken in front of academic, government, and civil society audiences in Switzerland, Canada, and the United States, as well as the UK. She's also been in Latvia and South Korea presenting. As the founder and executive director of Developing Young Leaders of Toronto, today, her organization utilizes sustainable development goals and 3 core themes of International Decade for People of African Descent. They are recognition, justice, and development, specifically to advance domestic and foreign policy development. It's so lovely to see you again. Welcome. Carolyn O'Connor is OASW student director and a doctoral candidate at the Factor and Montage Faculty of Social Work at University of Toronto, where she also works as a course instructor for 2 practice-based MSW courses. In addition, she's a social worker serving clients in private practice. Her research includes complex childhood trauma, particularly exposure to intimate partner violence, as well as violence against women, sexual consent, and sexual violence prevention. We're so pleased to have you both on our board, Carolyn, and here with us today. Thank you. And Audrey Thompson is a passionate advocate who many of you may recognize. She has been a faculty instructor with OASW. She believes that individuals can be a vehicle for empowerment and change, especially amongst those who have faced adversity in their lives. She's held numerous positions during her career, including individual rights and systemic team advocacy. She's a rights coordinator and a program coordinator. She has designed and conducted many workshops in Canada, Japan, Argentina, Denmark, and various areas, including sexual health, rights, life skills, facilitation, knowledge exchange, and employment all live in her experience. In addition, she founded an organization dedicated to creating engagement platforms. We're so excited to have you as well, Audrey. So welcome to everyone. I want to invite you back here again today to have a conversation that we have had through so many other avenues, either through your opportunities to link with our members, through your faculty instruction, or through your work and consultation with OASW. Today, we've invited you to talk informally around the virtual table about the collection of race-based data, especially given that many organizations are beginning to think about decisive conversations across many sectors and settings, including us at OASW. We've seen many trends, as you know, in healthcare. We've seen the importance of health equity. We've seen most recently the need to organize and understand the effect and the implications of disproportionate realities for COVID-19 on racialized communities after COVID-19, especially communities that are Black and Indigenous. We've seen risks due to precarious employment, where people have lived with many complexities. We've seen vaccine controversy, and we have seen what data collection can do and divide in terms of conversations amongst decision makers. We've also seen post-secondary education within school boards, child welfare agencies, all start to think about how they're going to address racism, DEI, EDI, colonization, belonging, and they've been thinking a lot about race-based data as an accountability standards. In fact, we know that many organizations are starting to think about this as part of their strategic plan. Recently, in our strategic plan at OASW, under one of the 4 directions for the association called Leading Equity Integration, we thought about this thoughtful data collection and what it means to collect disaggregated data and where gaps might exist. And so we've been advocating and thinking about this social work practice and policy. So I'll start with our first question. As leaders, what has the last few years brought in this space of race-based data collection? What comes to mind for you as you think about the nonprofit sector and what's important for us to organize right now? I'm going to start with you, Candice.
Thank you so much, Deepy, and absolutely a wonderful pleasure to be on this panel with these incredible colleagues. So there are several things, several key occurrences that have converged to concretize the need for, I'd say, race-based data collection. So as you mentioned in your intro, the onset and fallout of the COVID-19 public health pandemic, that really kind of pulled back the curtains even further on the inequities in access to quality public health care, as well as exacerbated the fragility of social determinants of health infrastructure across the country for racialized people, particularly Black and Indigenous communities. Additionally, the rapid impact and influence of Industry 4.0, and that's the digital revolution, where as a function of the migration to and dependence on digital platforms during lockdowns from COVID, it necessitated virtual-based learning and work from home societal changes. So we're now seeing that the influence of generative technologies and automation is adversely affecting predominantly racialized and specifically Black communities, according to the OECD. So, and then the final piece is the application of the UN SDGs as a method to address social problems and systemic inequalities across 193 countries. So basically on a global scale. So these goals that range from eradicating hunger, achieving quality education, providing decent work, reducing inequalities, and addressing climate change and creating justice and strong institutions. These have targets and indicators that require the collection on data for accountability of state signatories, progress measurement, and inclusion of civil society organizations as equal partners working towards the achievement of those goals within a specified time period. And all 3 of these life-altering scenarios have necessarily increased the need for disaggregated race-based data to paint and reinforce a clear picture of what is truly happening in communities using an intersectional lens. And at Dialot, where our constituents are primarily Black young professionals, we've had to deliberately include race-based data in how we deliver services to Black youth, based on the fact that Black children and youth are the fastest growing and youngest demographic of the Canadian population, according to StatsCan 2021 report. And we've also had to delineate what this data represents in terms of education to employment outcome, with factors such as higher unemployment and underemployment rates, as well as exposure to precarious work, and the ramifications of the mental health concerns stemming from generational and systemic racialized trauma, and of course, media trauma during the COVID-19 pandemic and the public lynching that we saw through media of George Floyd and Breonna Taylor and others, and all the other televised murders, the criminal justice and child welfare indicators that provide no escape from the violence perpetuated on Black communities. So these are significant areas that we had to encounter and grapple with over the last 3 years.
Absolutely, and the world has witnessed the need to step up and do things differently. It's a big step for any organization to even think about how to address this, especially small nonprofits. And Amika, do you have any advice on how we can think about this collaboratively, or what comes to mind for you, given organizations are starting to think about race-based data?
Yeah, I just want to pick up on a point that Candice had brought out around under-engagement and under-representation. I think it's really, we have to think about these two things as very distinct, and they operate very differently. So just again, when we're thinking about how people are engaged, understanding that there's an intentional action to when people are under-engaged. We have to understand, what's the context around that under engagement, and then underrepresentation as well. Is again another way in which this operates. Exclusion operates, and we really need to understand and sort of locate that within the discussion, because that speaks to the nuances of people's experiences, right? And that's what we're really trying to get at, is exposing that and bringing that forward.
It's a great point, because 3 years ago, it was the under engagement statistic that led to us striking the Equity Integration Advisory Group. So it's a great reminder, inviting underrepresented voices to address the important issues at tables where voice has not often been there. And so it's a great reminder. Any other thoughts, given your many years of experience in advocacy, thoughts on race-based data collection? I think you've got a whole history.
Yeah, I think it really comes down for me around, and I guess it's given my experience, this is about a reassurance of public trust. And we know historically, as social workers, how we have been engaged as agents of the state, and as gatekeepers of services, and as really detrimental agents that have worked with communities and impacted people's lives greatly in many different ways, and not all positively. So there's a reconciling of our own that we need to be doing as a profession. And it really, for me, that's one of the most important things this is about public accountability and public trust. And we need to be reassuring the communities that we're working with that we have been reflective, we understand our historical wrongs that we've committed as a profession, and the ways in which we're moving forward. We have to be able to articulate empathy and understanding and a willingness to change in the process. So this is one of the ways I think that it's a first step. So let's be clear, this is a first step to understanding and exposing what the issues might be, and helping everyone sort of gain an understanding of how these discrimination impacts and affects and is operationalized in many different ways. Because when we think about intersectionality in this, and think about it from the prism of intersectionality, the ways in which people are experiencing many different forms of discrimination, exclusion, has to be examined from all sides and all contexts.
Audrey, I see you nodding.
I am sorry. I'm trying to move with all the shadows. I think it's a really important conversation, and I think for me as a practitioner, as a woman of color, this has been a hard challenge. It's a very sensitive topic. Because there's a lot of questions that arise for me, in terms of collecting race-based data from both points of view. So I think that it's important in the last couple of years, what I've seen is we're naming things, and particularly young people and families who have been affected by poverty, by COVID, by this discrimination. They're calling on adults, they're calling on practitioners to name it. We're not in the shadows anymore. let's name what's happening. And the only way for us to be able to do that is to be able to collect information and be able to provide those policymakers and people on different sides of the fences, the numbers to show that we are representing a voice. We are representing people who are impacted by these procedures. And also, I think our field is also asking us to be leaders, right? And I think as social workers, we've shied away. I've been in many different institutions who've shied away from this topic because it's a hard topic. And I think the fact that a step is being taken to say that, we don't have all the answers. There's going to be some glitches along the way. However, but let's stop this enfranchising people by not counting them. So I see this way. This is as a way of counting people who've been left behind.
You're talking about starting with a step, and I hear an element of accountability in all of what's been described. Carolyn, I'm thinking about you, who just joined our board a few months ago, a leader and a practitioner in the field. Why is this important to you, and what do you see reflected in the work that we're doing at OASW?
Yeah, thanks, Deepy. So I come at this discussion from I would say, a research lens to some extent, and being in the research world and in academia, I'm acutely aware of how oppressive those systems have been for people of color for many years, and how, quite frankly, triggering the word research even is, given its history of exploitation and take and no give. And so it's of course extremely understandable that folks have a reaction to race-based data. I think that, Candace already mentioned this, but being able to have a way to identify and monitor services, both at the individual level and the system level, what kinds of biases and discriminations and stigmas are we still working with and trying to eliminate? And from an ongoing evaluation perspective, we hear a lot of organizations, say that they are integrating this lens and they're working harder to eliminate those things, but it's challenging to monitor and have some accountability for that. So I think that's one piece. And on the research side, I think it's, besides being an evaluation tool, it's an advocacy tool. Funders, the powers that be, policymakers, they want to see numbers, they want to see concrete data to inform where they put their money, what they advocate for, how to justify their decisions. So if we can show that there is a need for more money, more resources, more supports, depending on the context and who it is that we're talking about, if we can demonstrate that in a concrete way, I think it does go pretty far with some of those folks to make a strong case for increasing supports, especially when we can also show that this is what our example, for instance, the OASW, this is what our membership looks like. And also this is what's out there in terms of supports and resources, and show that there's a mismatch. I think it can be a really powerful tool for that.
Yeah, go ahead, Anamika. I was going to just say research made me think, I know where you maybe headed, what about the historic misuse of data and things like that? But Anamika, please go ahead.
Yeah, I wanted to pick up on a couple threads that both Audrey and Carolyn landed there. And I think it's really important that this data is about helping us and others who are not directly impacted or not particularly part of these equity groups as well, to be able to give us language, to be able to talk about other people's stories and be able to represent other people when they are not in the room. Like, this is very important for us as a profession in terms of our overall accountability and our individual accountability as social workers, to be cognizant and aware of the impacts, not only of our individual actions, but also of our organizations and our communities that we have to represent. And sometimes we're taking on the voices of our clients or our communities. Again, whether we are closely connected or a part of that community or not, but we are representing them, and we need to be able to, this is one way to start to help those voices get heard in the different spaces and understood in a different way. The other, I think, piece around that is also thinking about the context in which this is happening. Like there's been a real shift and you know, a desire to have equity and equity roles in organizations. But that means resources have to be put to this. And this is not just a momentary action as well. So I think those are some of the commitments in a long term we also have to be considering as we're moving forward. And then the other piece that makes me think part of this discussion is about that notion of counting, right? We think about this as a sort of a quantifying of people and quantifying of issues. And we have to be really careful with that. And I don't think that that's what Audrey was suggesting. I think that that is most often how we go and we start off this process, is trying to account for those numbers and trying to account to make the case for why these supports and services and conversation is so necessary. But there's a danger in doing that. And I know we can talk a bit more about that as we go along.
Yeah, for sure. Candice and Audrey, just thinking about the definition of measurement, the use of race-based data, building trust within anti-racism and anti-oppressive practice. What are your thoughts on that advice to us as leaders in the community and specifically OASW? And you think about us as a non-service provider. Why would we want to do this? Why are we going down this road? So I wonder if you want to build on what Anamika was saying. I'll start with you, Audrey, and then I'll go over back to you, Candice, and then Carolyn.
For me, this part of this reminds me of the census conversation. We all remember the long form census as practitioners, and we're fighting because we knew what impact it had in the work that we do, and then also the representation. So I think for me, it was like taking that information and taking the accountability and taking the format, creating a format that embeds the social work principles, embeds those values and how we collect the data. It's not just going to be a one-off conversation, a one-off dialogue. There's different mechanisms of accountability that's going to be attached to it because of our profession, and creating something that's useful for not only us, but for other sectors. So I think it's about, for me, not waiting for other sectors now to figure out how information is collected. We are the advocates. We are the people with the skill set. So let's do it from that foundation. So I think that's a big piece for me. And so with the association, I think having different key points along the way. So this is just not a one-off conversation. So we can have this dialogue, but there's other means of various individuals to be engaged. It's an ongoing working mechanism that we continue to build. So I think those are the things I think about. And also acknowledging that, there could be some mishaps, acknowledging there is legitimate fear that people have because of the collection and use of race-based data. Like, I think even having this dialogue, having this conversation is just a one more step that we just keep adding to those steps.
Yeah, I picture it like building blocks and heading towards a journey and sometimes having to tumble backwards. Boy, have we tumbled a few times. So thank you to you and many of you who've helped along the way to help lift us and keep at it. Candice, I see you nodding as well. What are your thoughts? What do you want to add?
Yeah, I definitely feel that this is an important conversation, and as many of you talked about already, a first step towards an anticipated outcome. I'll say that. Personally, around this, I feel like this issue of mistrust in data collection is always about who is collecting the data, how is it being used, and then what will happen to that data after that initial collection. It ultimately comes down to power dynamics. It's always about power dynamics. Are the people collecting the data reflective of the communities that the data is being collected on or about? And I feel like there has to be an intentional, and I use that term very intentionally, intentional interrogation of how relational power is being applied in each scenario. So there's always that inherent feeling of, can this data be used against me? So I'll speak from my position as a Black woman social worker. Black woman social worker who is a mother, a Black woman social worker who is working in a space in a nonprofit sector that is uniquely marginalized. So I come with all of these intersectional pieces to my identity that aren't always considered when I am filling out an application form, or I'm filling out a survey or a questionnaire about my job, about the role that I perform in the community or anything like that. But it's always in the back of my mind, when this data is out there about me, I no longer have control on what the narrative that is created about me is. So all of those things are always being considered by the people who are the subjects of this data collection. So it often deters people from divulging personal information, right? Because of the fear of what's going to happen to me because I've shared this information about me. So therefore, in the process of collecting the data, there has to be a transparent process of how the data will be used as an equity-informed transformative tool. So the consideration is, does this data lead to institutional transformation that benefits racialized people, especially because typically if we're looking at race-based equity within institutions or within society, broader society, we have to think about that information. There has to be an end goal that is clearly understood to minimize that pushback or mistrust. So for example, and Amiko talked a little bit about young people, and as we're creating this space for young people's inclusion, whether we're looking at the education sector or we're looking at the employment sector, young people come with a plethora of additional supports that they're going to need. And in order for us to create that supportive environment, we have to consider those intersectional pieces. Whereas if we're also not making the space making for communication, how is this going to be used? How can you also track and contribute to what the outcomes will be? Then young people automatically start pushing back, saying, no, we're not going to participate, which is, of course, is a detriment to the progress that you're looking to make. So really thinking about, yes, the first step, the beginning, but also having vision to the end goal. Here's what the journey will be like, and here's the outcome that we're expecting, and here's how you walk with us to make sure that, yes, when mishaps do happen, because it is reality, things don't go 100% according to plan, but here's how we are putting those supportive and remedial mechanisms in place, so that if we do make mistakes, if the ball gets dropped at some point, here's how we're going to come back and collect and rebuild trust as we go along, so that people feel like, okay, yes, it might feel scary, but there's also the opportunity for us to develop solutions along the way when those missteps do happen.
Yeah, it sounds like you're talking about building momentum and being okay with that momentum taking some time. I sometimes see it as an easy push up the hill, and other times, that boulder rolling back. Any thoughts, Carolyn, on what it would take to build momentum in something like a strategic plan for an association or otherwise? I'll open up to you, and maybe would love to hear from others if they've seen examples of how this has been done well. The conversation starting, the building of momentum, the acknowledgement of transparency. Where have you seen some examples? Carolyn, any thoughts on that to get us kickstarted?
Yeah, I think that, in a lot of the documents regarding advice or suggestions for this is to engage the community early and engage the community often. So I really like the way that Audrey framed this discussion around being grounded in social work principles. I think that's a really great place to continue to bring ourselves back to. So whatever those values might be, it sounds like, transparency, accountability, consultation, agency, self-determination. So I think, simply the fact that the process is voluntary and it's an opt-in is a great way, I think, to start building that momentum and that trust that, the way that this data will be used is actually in line with the needs of the community. I think Audrey also mentioned this, and it's really important that the transparency is there and there's follow through as well. So not just that, we're making all of these claims of what we're going to do, what the outcomes will be like. What are the deliverables? How are we going to ensure that we are keeping everybody abreast in terms of what's happened? Are we meeting what we said we would set out to do? What is the value added for stakeholders? Like, is there a way that we can make this so that it's there is a tangible value added for those folks beyond just hopefully some systemic change or moving the needle forward. But yeah, I think in terms of just offering agency, offering choice, depending on the situation that you're in, where you're looking to get that data, you want to assure the client or whoever it is that their decision to opt in or out won't impact the services they're receiving. Like all of those sorts of like really transparent, offerings are really important, I think.
Great points. It also, not even for service provision here at OASW, the opt-in is part of what we've launched last week in our e-bulletin and our FAQ link to start filling out demographic questions affiliated with your profile. Super important to build in the transparency around why and how, and also the opt-in. It's a great reminder. And Amika, it looked like you had some thoughts to add.
Yeah. I just wanted to also put out there, like, much of this is not arbitrary, right? Because I think sometimes when we embark on this and when folks have reservations or concerns about this, there's a sense of there isn't accuracy. They're concerned about, as folks mentioned, how the data is going to be used, how it's going to be collected. I have to say there's a lot of information and helpful instructing, guiding information. And when we look to other professions that have undertaken this, or other sort of institutions and organizations, they have provided, there is guidance around this. So I just wanted to make sure that this is not an arbitrary process. And I think we appreciate that going in, that OASW, as they undertake their process, will also look to and seek guidance from their partners that may have also done some of this work. And certainly, I think for those of us on this call, we're happy to provide any resources to be able to share with others who are thinking about this or have questions around that. We have a Human Rights Commission. This is about a risk management process, because sometimes that is not how people come to this, but it is about risk management as well. And when we think about what people are expecting in terms of the way they engage with their services and their support systems and their communities, their institutions, they're expecting accountability, and they're expecting that they will be met with a level of respect and dignity, and have the ability to be consenting. So this is all wrapped up in our process of beginning to think about data collection, race-based stats, and the future of where it takes us. And we have to be prepared to be led by that information too. That's the other thing. Yeah. These are not we can't really, there's some things that are known, and then there's some things that are not known.
Right. And we have to be willing to adjust. I love what you said about it not being arbitrary. We definitely didn't wake up one day and decide that we were going to just do this. In fact, I hold some privilege in the decision-making power of the OASW CEO role. And this journey has taken 3.5 years to get us to this spot. And that's with some privilege and board partnership, along with our Equity Integration Advisory Group. So I can't imagine what it could feel like for a new up and coming leader or social worker or colleague to start this journey. And I have all of you to help back me for that and help us make some mistakes together and grow from them. Audrey, I was thinking, there's lots of great reactions coming to the great conversation we're having. I want to ask you a big but mighty question. How do you see the collection of race-based data fostering a more inclusive and just society? What do you think?
Big question. First, I want to say we collect these data already. As practitioners, we know in our institutions, we ask, right? We ask if people are First Nations, if they're racialized. And so this is one of the tenets of our work that we do every day. So now we're just sort of turning the tables and saying, okay, let's look at SF as professionals. So in terms of I think moving forward, I think it's going to be very, I think we're just going to be coming together as a practice. I love the leadership of the association in moving this forward, because I think it's going to have a rippling effect, not only on the association, but other social work institutions, but also the education system that, you know, social workers come through. So I think it's a really good base for us to start off with.
Yeah, I agree. You know, Candice, I'm thinking about tossing you a question already that I saw pop into the chat, which is feeding off of what you were just saying, Audrey, around starting and moving and anchoring on our principles of social work. So I want to ask you, I'm going to start, you know, our team knows I go off script all the time. So I'm going to ask you a question popping into the chat pre the question time. What are the best ways you think to or even best practices to analyze and present race-based data? So we've been talking about the collection of it, but the transparency also includes the share back. What are some good practical ways to present that back or share some of that back, especially if you're not going to wait years and years before you do that, and you maybe want to do it shortly after you've started?
Yeah, so I feel like, so in the context of social work itself, the profession of social work, we have a lot of opportunity to collaborate on things. We have a lot, this panel in itself is a best practice, right? Because we all come from varying practice backgrounds. And in each of the practice backgrounds that we bring, you know, multiple years of experience, we've had the opportunity to see, to engage in, and to evaluate the different ways that data is collected and used, whether it's in the academic sphere, or, you know, in community practice, or in my case, quasi-government view. But nevertheless, the opportunity for us to always talk together about what the impact of data collection is, how it's being experienced by communities, right? So I'll use a case in point here. So we recently at Dialog we're doing an advocacy push around the creation of a youth secretariat to the Permanent Forum for People of African Descent at the United Nations level. And we had to look at data. We had to ensure that how we were legitimizing this proposal to develop this forum for youth engagement was steeped in what youth communities were asking for, right? So the thing that we had to do was look at all the grand scheme priorities of young people: employment, education, belonging, mental health, climate, all of those big thinking areas, and then look at young people as those solution holders, as opposed to, you know, practitioners or government decision makers or academic institutions as the sole holder of decision-making powers. We're looking at young people as those solution makers as well, those change makers as well, and calling them in, right? So I think in that scenario, the best practice is collaboration, making sure that we're sharing power, always the decision-making power is being shared. And then also that we're looking at those big ticket items where, you know, it takes multiple people thinking together, from, you know, bringing different ideologies of how to solve this issue, all of us convening together, whether it's through conferences, forums, classroom setting, you know, teaching and learning together, but all of us having those continuous conversations in different settings, and thinking about who do we bring to the table when we want those solutions to be brought forward.
It's a great point around collaborative sharing. And also, it sounds like you're talking a little bit about doing that frequently and often, because the collaboration itself may change the way you actually share the data. Any thoughts from any of the other panelists on best practices for sharing and analyzing and even sharing back?
Not a thought, but I was just thinking out loud. it might be interesting, even for as a practitioner. So the association has that information, and as a practitioner, we're able to maybe either through an RFP process or maybe an inquiry process, say to the association, hey, I'm doing this project, I'm working on this thing. Can I get the data? This is what I'm going to do with the data. What do you think? And so that way I'm held accountable to the usage of the data, but also as a member, I have access to that data in one form or another. And also I'm thinking about the youth groups that you know, can use that. And so that's just a thought that just came to mind.
Yeah, it's a great thought. And Amika, do you want to build on that?
Yeah, I was just thinking, so one of the ways TMU has been thinking about their data collection, but also the impact of the data and the impact of their particular responses is to do a report card. So there are attached measures, and that's a really important piece that we, we have to also have the community and a greater engagement of those that are directly impacted to be able to define what those measures look like, what the outcomes also look like in those potential possibilities. So as an organization, I think absolutely we have some big goals in mind, but then how again, those nuances of how that, what that looks like and what that means when the rubber hits the road, I think, is really important, again, to have community and have others help to define what those parameters of, again, dissemination, what the information is, what are the questions that we're asking to as we're going along. It's really important for us to engage folks differently and think about a participatory process.
Yeah, I like the idea of a report card, and then tagging into your idea of participation and how people inform the report card and how we actually share it back at different points in different ways, since we digest the information differently as well. What about organizations that maybe are looking to collect race-based data and they want to do this in an equitable, trauma-informed way? For example, thinking about money, education, patients, those kinds of things. Carolyn, any thoughts about that with your trauma-informed clinical lens?
Yeah, I was just going to say, I mean, of course, it does depend on the format or the medium in which you're collecting the information. So if you're using a survey, whether it be online or paper and pencil, perhaps doing some pilot testing with different groups to see how that is, what that experience is like, if there are any concerns. And I think if you're doing something face-to-face, having adequate staff training in place for how those questions are asked. And I think part of the sort of previous question around data analysis and things like that, people often say numbers don't lie, and that's a really popular sort of slogan. And numbers absolutely do lie, or they can be manipulated to tell a different story depending on, the needs and the interests of the writer. So I find often, just as a general rule of thumb, that the way in which oftentimes it's manipulated and misused is when it's stripped of context. So providing nuance and providing context, it's super, I think, tempting to want to have a flashy sort of one-line sentence that we can put on our reports and make it stand out. But I think without the context, it can be very easily used to reinforce stereotypes or, have an opposite reaction that we're looking to create. So anyways, I wanted to answer that piece on that previous question. But I think, otherwise, an important piece of this, and I've said this before now a couple of times, but that transparency and what are the outcomes that we're looking to do, drawing it back to the research questions, if that's something that we'd like to sort of ground ourselves in. But that is often the way that we practice. And how are we answering those? Who is this for? Just continuously being open and engaging often, I think, can help build trust over time.
Lots of good positive reactions and agreement coming from our viewers. Candace, what do you think? I see you nodding as well.
Yeah, I actually just wanted to piggyback off what Carolyn just said. I think this necessitates a layered response and approach, right? So while there is that sense of the first step is collecting that data, there's also the analysis of the data and whose lens are we analyzing that data from, and then there's the evaluation, analysis and evaluation, and then the dissemination of that data. So throughout the process, we can't have a homogeneous lens interpreting the data, right? It has to be community inclusive. That space of belonging has to be created where we feel like everyone who is engaged in the process has ownership over what happens as well, right? And in order for us to all feel like, as part of the OASW, we feel like we're all owners of the information that gets disseminated from here, then it's that, when we talk about measurement and accountability, it's that feeling of, I've contributed to what the association will look like. And if something does end up going wrong, it's also my responsibility to help to right that ship. You know what I mean? And that enables people to feel like, you know what, I want the best outcome because I'm a part of it. I have a stake in it. And so it also means that people don't feel like, if something goes wrong, I can easily walk away and it's not my problem. It's all of our problems because we had a hand in creating it, and we have a hand in making sure that there's continuous development over time. It's not just a one shot, one and done. It's a continuous work that we're all contributing to. So
I love that co-construction, co-risk management, co-problem solving. We have seen so many of our members in the last year to step up to personally help me with issues of anti-racism, with personal issues of racism that I've experienced, with helping other members who have experienced difficult interactions. We've had folks step up to even offer allyship and what it means to move to be an accomplice. We've had folks question and query in good and open ways to be called in. So I think you're even talking about some of that, but also taking it a bump up and saying, a report card, as you talked about, Anamika, is one step, but you want to contribute to what you want to see and hear and how you use it, Audrey. And then you want it to be trauma informed and thoughtful in how it's crafted, Carolyn. And then Candace, I think your nice summary around join us in this journey. Tell us when we're doing it right, but when we're not doing it right, please help us solve the problem in a nice social work valued, principled way. Carolyn, I think you maybe want to add to that. Go for it.
Just something really quick to piggyback off of what Candace said, because I thought that was really, really like empowering. I think that sense of pride and ownership is it makes me feel like there's more of a community here, and something that folks can be really, excited about. A tool that we use in qualitative research called member checking is something that I think could be also a helpful tool here. It's typically used with qualitative, as I said, but even with quantitative, just bringing in folks from different groups, different types of social workers. Why do you think we're seeing this sort of membership demographic? What is your take on that, as a way to maybe do a little bit of mixed methods, but just as a way to help interpret from the lens of the people who actually completed the survey? So that's, I think, another suggestion.
Yeah, it's a great suggestion. And Amika, were you going to share?
I just wanted to underscore what folks have talked about. The relational aspect of this work is so critical, and it is what will make or break what happens, right? And that means it's going to be a slow journey. It doesn't mean we can run ahead. It means that we are only going to know part of the story, and we have to be prepared to sit in some discomfort and be friends. Like, we have to be compassionate and give each other grace, because I know I've stepped in all kinds of shit, and thank goodness I had some friends along the way that could, pull me back in and talk to me and in good but stern and helpful ways. And none of the work that I have been able to accomplish has ever been done without the collaboration and the coalition building. It has been so strengthened by people helping me to figure out the things that I don't know. It's a continuous reflective process. And that's what we hope for. I hope for this profession, and I hope that OASW leads.
Yeah, I agree. If you are an Equity Integration Advisory Group member right now listening in, please give us a fist pump virtually, because boy, have we seen that happen in that group. We have seen us hold each other up and lift each other, and also remind each other when we're making mistakes in that 3.5-year journey to enter that particular focus area of leading equity integration in our strategic plan for the first time ever, which is so exciting. And so I am just looking at the time and thinking we had so much more to do and so much more to talk about. So I hope you take this personal invite on behalf of all of our membership to, I'm sure, continue. I want to say just a few things, but I want to also give you a chance to sound off with one good question I saw come in. So I'll circulate that in a second. But just before that, if you're a member listening in and joining us today and have some thoughts, ideas, concerns, resources, please don't hesitate to share them with our team at info@oasw.org, or personally with me if you have my email. And if not, please look it up on the website, you'll find us. Last week, you received an e-bulletin that included a link to an FAQ and link to fill out optional demographic questions as we take our first foray into this exciting new opportunity to share back with you who you are and where your identity is situated in the work you do, and how we can progress through this work together. We're so excited by that. And thank you to each of the panel members. I am so deeply grateful for not only your colleagueship, I'm just creating that word today, and your leadership in every space that you work in, and the fact that you want to influence this work with us and with our entire team. So with that, I'm going to sound off a soundbite for each of you. I'll start with you, Audrey. If someone's a community member in a community-based setting and knows that participants that they work with and are impacted by their services could be better off if we collected and targeted race-based data, how should they begin this conversation with their leadership in their organization? If this is not happening, give some advice to a social worker or a colleague out there. How can they begin this conversation with leadership in their organization?
I would say start with your colleagues, right? Build that team so that when you go to leadership, it's not just one voice, it's a collective voice. And also the people that we work for are really powerful. And sometimes they're a lot more honest than we can be. And so sometimes we need to tap into their skill sets and their voices. So partnership, collaboration.
Candice, partnership, collaboration, what else do you want to add to that?
I want to throw in community. And community in the widest sense of the word, in that you're doing the interdisciplinary work, right? You're not just looking at it from one lens of expertise. You're looking at where does everyone sit, and bringing all of those expertise together at the table, and making sure that we're all talking together, even if we don't hear and understand the way we speak. But the fact that we're talking together makes a difference, and we can always work things out, smooth things out as we go. But let's bring everybody to the table. Let's bring it community and bring food. Always bring food.
I got partnership, collaboration, community. I like food. Carolyn, and then Anamika, last word to you. Carolyn, what do you want to add to that?
I think just in addition to what's already been said, of course, like Audrey mentioned, support is huge, and community being part of that support, and to show that there is a desire for this beyond yourself as the individual practitioner. And preparation, of course, it's I think in terms of, this has already been mentioned when we think about surveying membership, but having a very clear understanding of what those anticipated questions or concerns are, and being able to maybe not resolve them, but speak to them and have an idea about how you might resolve those issues as they arise. So it looks like you've done your homework, and there's a real plan in place. I think is probably a good idea.
Support and planning. I like that. And Anamika, what would you sound off on?
So I'm just thinking about, I just want to flip the script a little bit on this, because the pandemic, what it did, it expanded the number of people that were coming to utilize services and supports from social workers and other mental health kinds of services. And they are new to some of these services. And again, thinking about their need to be feeling safe and trusted, and also have opportunities to self-advocate and also share complaints. It's really important we create those kinds of conditions. And that's what this kind of race-based collection starts to do. It starts to set up a system of accountability. But in terms of flipping the script, those are not just our minority populations. Those are actually the world majority people. We are serving the majority of racialized people are the majority in our service provision. And those other folks who ascribe to different equity seeking identities, they make up this majority. If we think about people with disabilities, they are identified as the world's largest majority. And all of those various identities are part of that group of people that we're serving. So I think we have to think about that and think about how that changes the power dynamics, changes the positionality of who we're serving, and why it's important for them to have voice and to have an engagement in this process.
Yeah, I'm so grateful. I have so many ideas, so many wonderful hearts, love emojis coming from your virtual colleagues out there. Just so pleased to have spent this hour with you. Thank you. Thank you to all the panelists. Thank you to all our members. We look forward to many more discussions. And with that, we'll close today.